UNAIDS is hoping to achieve its 90-90-90 treatment target by 2020. UNICEF believes ending AIDS will inspire global solidarity, evidence-based action, and multisectoral partnerships. And as we approach World AIDS Day in coming weeks, how close is South Africa in achieving the UNAIDS target? Joining me to discuss successes and failures is Right to Care spokesperson, Dr. Chuks Onaga. Thank you for joining us, Dr. Chuks.
Thank you very much, Vic.
UNAIDS has a very ambitious plan. I mean, 2020 is next year.
Yeah.
Maybe you can tell us about this plan, break it down, the three aspects of what they're hoping to achieve by next year.
All right. So thank you very much, Vic, and thank you for having me on your show. So it's a very interesting time for us in the world, and in South Africa in particular. UNAIDS has got this ambitious target of, for now, of ending the epidemic. And the target is that 90% of those who are HIV infected should know their status, and 90% of those who know their status should be put on treatment, and 90% of those who are on treatment should be virally suppressed by December of next year.
All right.
So it's very much around the corner, like you said. Yeah.
It's right. It's next year. And next year, and why I say this is ambitious, currently 79% of people don't know their status. 3 out of 5 people who are HIV positive are on ARVs. And 53% of people have an undetectable viral load. So, I mean, can this target be achieved by next year?
Yeah, Vic, thank you very much. The data you are quoting, there are we've been lucky in the past couple of months. There's been renewed vigor and more impetus in achieving these goals. Actually, in South Africa now, the first 90, we are doing fairly well. We are close to achieving it.
So 90% of people in South Africa currently with HIV know their status?
We are not there yet, but we are beyond your 79. We are closer to 80, 85, thereabouts.
Okay.
Where we've got a problem is in the second 90. So indeed, we are very much behind. As at the data we are reviewing sometime in August, as at June this year, we had approximately 5 million people out of the estimated 6.1 who should be on treatment already.
Right.
So in terms of gap in the program, we are short of meeting our target by 500,000 in the first 90, about 1.5 million in the second 90, and about 2.1 million in the third 90. But that is accelerating. Every second, many men and women and soldiers are out there hard at work, making sure that we have a good chance.
All right.
Yeah.
Dr. Chuks, let's talk about that second 90 that we're talking about people needing to be on treatment, ARV treatment. I know in the past that once your CD4 count was below a certain level, you had to get on treatment. Now, new guidelines are saying that as soon as you have been diagnosed with HIV, regardless of your CD4 count, you should be on treatment.
Yeah. So that is treatment as prevention. So, and also some people call it a test and treat.
Treatment as prevention. Explain to our viewers and for those
what it means.
What that means.
So treatment as prevention means that we are now using treatment as a way of preventing the spread of the HIV.
So to suppress the virus, and if you suppress the virus and you have an undetectable
viral load,
that
So basically, if you have somebody and you put him on the right regimen, within 2 weeks of being on treatment, the virus will be undetectable. So there
within 2 weeks.
2 weeks, if you 2 weeks, some will push it up to 1 month. But basically, the point is that U equals to U. That's what you may have heard. Undetected equals to untransmittable. And this is something very much that my organization, the organization I work for, Right to Care, we've been very much hard at work. And you see, very next week, I invite Newsroom Africa to be there. Maybe if you get permission from the Department of Health. The nation will be coalescing again next week, 20th and 21st, to have a Putuma review. At the present moment, we have in Mpumalanga, I flew in from Mpumalanga this evening, we have an HIV-TB Congress ongoing. So there is a coalescence of forces, and we as Right to Care, we are very, very happy to be part of that. In the programs where we are funded by the USAID, we have close to 450,000 people who are on treatment, and 2 of the districts that we support in Right to Care are what they call phase 2 facilities. So I'm saying I'm filled with excitement because I would say at the moment, there is very strong drive and leadership and accountability, both from the NGO sector, the Department of Health, civil society, and all of that, to meet this target. So what the National Department has done and has shown leadership is in separating, saying there are two districts that are going to meet this target. In December, you may have heard that a show in KZN already met it. It was well celebrated in Mexico. And the phase 2 facility, the phase 2 districts, right to care districts are in there. They are expected to meet the targets ahead of time by March of next year. So 15 districts are projected, are being urged on to meet the targets ahead of time, to meet the goals ahead of target. So indeed, it's ambitious, but as the Springbok has shown in South Africa, when we work together, everything is possible.
Anything is possible. Dr. Chuks, why go on treatment early? I mean, it's a very big decision to make. So when you're trying to convince people that it's important for you to go into treatment because we can suppress the viral load. I mean, at the end of the day, it's a big decision for them to make.
Yeah.
How do you convince them to someone as part of reaching this goal?
Yeah. How do you convince them? I must tell you that at the moment, South Africa, as you know, is the largest, by far the largest arts program in the world. And we are finding that we are in the last mile. It's difficult now to get the positives. So, one, we need to put ourselves in the shoes of the patients. We need to go into the mind of the patient.
Yes.
We need to make the facilities and the communities safe places for patients to come out. We have a gap, even as we say 1990, amongst the sexes, there are differences. So men are less likely to access care than women.
Okay.
Yeah. And helplessly so, children less than 15 years are also left behind because obviously they depend on
their parents.
Adults, right?
Yes.
So we need to take the message out there to them. We need to intensify the advocacy in the facility. We need to rejig the PhD re-engineering, ID clinic programs, rejig our health facilities so that it will be more welcoming to the patients.
Dr. Chuks, okay, you mentioned some of the scenarios, the profiles who are not accessing treatment. We understand sometimes why a child may have difficulty accessing treatment because they're relying on the adult. Women seek treatment more than men. Why do you find that men are not seeking treatment?
Right. So most men are alpha A men, right? Okay. Isn't it? They will say they don't want to be seen in a facility. Is a machismo kind of stuff.
Okay.
And they don't want to queue up with pregnant women and children. So we need to
change the stigma.
There's also a bit of stigma.
Yes.
There's also a sense of that maybe there is no good insights, all right, about what a man feels and what a man needs. So also at Right to Care, we are currently piloting a program with a group, Max Boxology PSA, and basically it's a program that is aimed to have male coaches in the facility, more coaches in the community that will be like role models that would pull men. And previously, as Right to Care, we also worked with Brothers for Life, with the new generation, with the Generations actor, to kind of be a role model. But over and above that, we also use technology as well. And these are all innovations that we are trying. Right. We use technology to identify where men congregate, and we take the service to them. So we should have a mind shift from waiting for men to come to going to where men are, to going where the adolescents are, to going to where the children are. There's integration with the school health program. And all of that.
Dr. Chuks, these are your key populations that you're focusing on, men and children, in terms of also to reach this target. I want to know, how achievable is ending the AIDS epidemic without leaving anyone behind?
You have to believe. And it is achievable. The country believes it's achievable. Definitely, as Right to Care, we believe that it's achievable. All we have to do is to pay...
Ending the AIDS epidemic or controlling it?
Ending. We are aiming. We remain strategic. We remain ambitious. We hope to end the HIV epidemic in our lifetime. But it will not come easy. It will be all hands on deck. And there are a lot of in South Africa, we have a lot of guidance from the National Strategic Plan, which is a very holistic plan, the 8 goals that talks about everything from prevention through treatment to the key populations you mentioned, to leadership, to mobilizing resources and all of that. South Africa is in a unique position because, indeed, because of accountability that is found in South Africa, there is quite a lot of resources, that are pumped in.
When you say accountability, what do you mean?
Accountability, so I use the word accountability in terms of when you compare, right,
yes,
with other countries, because we must say the good stories about South Africa. Yeah. So if there is a program, if there is funding to do XYZ program, in South Africa, chances are that you will definitely be able to account for what you have used resources for. This is definitely the case in the non-profit, the NGO sector. So that gives reassurance to the funders especially. And I work in a company that has been at the vanguard of implementing lots of large-scale programs, and that's able to Washington that had these umbrella grants that we are able to manage other grants. So that is something good going for South Africa, and that you may have heard that the United States government has reaffirmed their commitment to supporting the fight. And South Africa is also unique in that, actually, despite, you talk about the funding from donors and all of that, the country itself, taxpayers' money, is responsible for more than 80% of the spend on health. The reverse is almost the case elsewhere in Africa. So there's commitment, there's political commitment, even as there are transitions in the leadership in the Department of Health at the political level. You see even a quickening of the pace. So that consistency, that accountability, that leadership. And for instance, we've been lucky. I run a program in Mpumalanga, the partnership. So if I may just spend a moment to talk about what makes it work. Okay. So Right to Care at the moment is like the Blue Eyed Boys within the NGO sector. And we've been very lucky to have very close and productive collaborations between ourselves and the Department of Health. So, for instance, in Netland Zeni, we have strong leadership and commitment by the district management, by Mr. Ndluli. We've also got strong support from the House Directorate by Ms. Ida Makwetla and head of department and all the way. So,
thank you. Yeah. Thank you. That's Right to Care spokesperson here joining us on Newsroom Africa, Channel 405, Dr. Chuks Onaga, discussing the UNAIDS 90-90-90 treatment target plan. They hope to achieve this by next year, 2020. Yeah. 90% of people diagnosed with HIV must be on treatment, must know their status, and must have an undetectable viral load. Thank you for joining us. Newsworld's going to take a short break.
Thank you very much. Cheers.
Thank you.
Thanks.